Welcome everyone. Thanks very much for joining us today for this webinar on informing policy on COVID-19 with rapid data, reports and responses on the RECOVR surveys in Côte d'Ivoire and Burkina Faso. My name is Arthur Sagodvoru. I'm the Policy and Project Development Coordinator for IPA in Francophone West Africa, and I'll be moderating today's session. Just quickly before we get started, I want to let everyone know that there will be time for Q&A at the end of the session. So at any time you can send your questions through the Q&A box at the bottom of the screen. And we will answer as many of your questions as we can at the end. Second, just so you know, the webinar will be recorded and available after the session. Okay, let's get started.
Hello?
Today you will be hearing from 7 different speakers. First, Annie Duflo, our Executive Director, will be presenting IPA and the RECOVR initiative. Then Marius Chavy, Country Director for IPA Francophone West Africa, will tell us about the context and the demographics of the survey. After that, Shayna Warren, Research Scientist, together with Samuel Kembu, Country Representative for IPA Côte d'Ivoire, will present the results of the surveys. Finally, we will be hearing from Ben Anderson-Coffey, Technical Advisor at the Côte d'Ivoire's General Direction of Employment, and Tessa Swigart, Research Manager for Development Media International, on what their interpretation of these results are and how they can use those to change their policies and programming. I will now give the lead to Annie Duflo to present IPA and the RECOVR initiative. We can move to the next slides.
Hi everyone, good morning, good afternoon and welcome to this webinar again. Bonjour et bienvenue pour les francophones. First, I'd like to again thank the General Direction of Employment of Côte d'Ivoire for their continued partnership on the survey we'll talk about today, as well as Development Media International for joining us for this webinar. Before we dive in, I'll share a few quick words about IPA's mission and then about the RECOVR initiative. As everyone here is very aware, extreme poverty remains an urgent and widespread problem. The global community and first and foremost governments from countries around the world spend billions of dollars to tackle poverty-related issues every year. So it's critical that these resources get spent on what will have the highest impact. Yet it's been estimated that it's less than 1% of resources in the international development field that get spent on research and development. So simply put, IPA exists to help fill this gap and solve this problem along many partners. Next slide, please. So our work has 3 pillars. We generate evidence about what approaches work best to address poverty-related issues. And we do this through a process of co-creation with decision makers and practitioners to ensure that we ask the relevant questions. And we share this evidence strategically, and by that we mean to the right people at the right time. And we do this both at the global level like today, but especially at the country level with our partners to inform their decisions and their programs. And throughout this process, we also work to equip decision makers and our partners to use evidence to improve programs and ultimately lives. Next slide, please. The way we work is that we partner with and support a network of several hundreds of researchers. And together with practitioners and decision makers, we identify issues faced by the poor. And we identify or often design potential solutions to these issues and evaluate the impact of these potential solutions to understand which ones will work best. And we champion and support the use of evidence throughout this collaborative process. We work across sectors, from education to financial inclusion or peace and recovery. And to date, more than 800 evaluations have been conducted around the world with more than 400 researchers and partners. We're currently mostly focusing on the 22 countries where we have an office and a long-term local presence and relationships. So while a lot of our work involves face-to-face interactions and therefore has been delayed with the pandemic, we also have been quite busy during the last 5 months, and among other things have conducted a lot of phone-based data collection. One of the things that we have focused on and that you'll hear about today is the RECOVR survey. That's a rapid response panel survey, so it's descriptive data, to directly inform our key government partners on the health, economic, and social ramifications of the pandemic. And that's a survey that's really been designed in collaboration with our partners to ensure that it answers the most pressing questions in 9 countries. We've also been developing more than 80 new studies related to COVID-19. Some of these studies build on existing impact evaluations to understand how pre-COVID programs help cope with the pandemic. And there are also many new studies that are being developed to inform the design of new programs that are aimed at mitigating the impacts of the crisis on health, livelihoods, learning, and other outcomes. We've also we are collaborating with several peer organizations to centralize and share resources, research resources, funding opportunities, surveys, to inform global stakeholders through a global hub about the efforts that are happening to mitigate the economic impacts of COVID and to also advocate for more resources to be allocated to these economic responses. Most of what we have focused on these last few months has been done in partnership with our government partners. Indeed, over the last 5 years, we have partnered with dozens of ministries in over 15 countries. And most of these partners have had urgent requests for data needs and evidence-informed advice these last few months. So we've been supporting with that. For example, with our partner organizations, WireEyes and SIGA, and a group of researchers, we have been advising the government's social protection responses in a bunch of different countries, Bangladesh, Ghana, Nigeria, Togo. We've also been supporting other countries with responses related to their education system, distance learning. And finally, as we are collecting a lot of data using phones, we're also layering on methodological research to strengthen our knowledge of how to conduct phone surveys effectively in this context. So thanks again for joining us today. I will now give the lead to Marius Chabi, who is going to present the context and demographics of the RECOVR surveys in Côte d'Ivoire and Burkina Faso. Thank you.
Thank you, Annie. Thank you. So basically, today we are going to see the result, and I will be talking about first the timeline for the policy decisions, and then the demographics, and finally the key takeaways. And please have a look at the top right of the slide there. You'll see the map of Côte d'Ivoire. So when I was talking about Côte d'Ivoire, you keep seeing that map. And then when I will shift to Burkina Faso, you'll be able to see the map of Burkina Faso. So basically, the COVID survey, the RECOVR survey in Côte d'Ivoire took place from the 1st June to the 15th June. And what we can see here is that we have different measures being taken by the government of Côte d'Ivoire. You have what we call the health-related measures, and then we have the economic measures. So one thing which comes here clearly is that the COVID survey IPA conducted took place at the point where most of the key measures were already into place. So this gives us the possibility and the unique chance to see actually what is the effect of all these measures and how the general population felt the measure were affecting their lives, etc., and the outcome, the livelihood. Okay. That's the key takeaway on this one. Next, please. Then, when we conducted this survey, overall, we found out that the average age of the respondent is 40 years old, and 3 respondents out of 10 are women, and the household size is 6 in Côte d'Ivoire. And we also noticed that about 40% of the people completed more than secondary education. And interestingly, the poverty, we found out that 36% of people were under the poverty line, estimated by the IPA Poverty Probability Index, which is a matrix we use to compute the probability of a household to fall into the threshold of being poor. And we use that through a certain set of questions. And basically, as I was mentioning in the beginning, we had run this survey from the 1st June to the 15th June in Côte d'Ivoire. And we used the RECOVR database, which is the database around employment and informal sector in Côte d'Ivoire. And we obtained this through our strong collaboration with the Direction of Employment in Côte d'Ivoire. And I want to highlight that when we conducted these calls, about 4 calls out of 10 were successful, which is quite great, which tells you how our respondents were really generous with their time to pick up our calls and answer our questions. So the key takeaway for Côte d'Ivoire is that 41% of respondents feel at risk of contracting COVID. So people were really concerned. And then over 7 respondents out of 10 have depleted their savings to pay for food. They use all their money to pay for food. And about 7 respondents also out of 10 reply that they earn less during that period of our survey. And also we noticed that about 4 respondents out of 10 who were employed said that they worked less hours during that period of survey. And finally, about seven respondents out of 10 who had children said they plan to continue using the ENESA platform. ENESA platform is a platform through which SMSs are sent to households to improve, to caregivers to improve the learning outcome of their kids. Okay. So that's for Côte d'Ivoire. Now we are going to see what happened in Burkina Faso. So similarly to what happens in Burkina Faso, there are measures, and you might have noticed Côte d'Ivoire took more measures than what has been taken in Burkina Faso by the quantity. Still, you can see here that the different measures were taken quite early, since March. And then we took the survey right after. So when you look at, for example, the blue line below, the curfew stopped in Burkina Faso around the 3rd June, and we conducted the survey from the 6th June. Still, the effect was still there because during the curfew period, activities were affected, and then we could see clearly what would be the impact here. So both timelines shows basically that IPA conducted this RECOVR survey at the right moment, and we are able to see what exactly happened in terms of effect of the different measures and also how people perceive COVID during that time. So in terms of demographics, what's happening here in Burkina Faso is that we have about, people are relatively younger here. We have 31 years more than average age our respondent, and the same type of metrics as in Côte d'Ivoire. 3 respondents out of 10 were women. The household size is 6, and 38% completed more than the secondary education. Here, however, the poverty level is very low. We found out that people under the poverty line were just 11% of the sample size. So in Burkina Faso, unlike what we did in Côte d'Ivoire, we used the random digit dialing through a national representative sample set. So those who might not be familiar with this, it means basically we generated functioning phone numbers, and we use these phone numbers to call them. And before calling, we do not know who is that person. We do not know the name of this person. And interestingly, what happens is when we call them here, 1 out of 2 calls were successful. So people really were generous to pick up phone calls and answer these questions, because this is quite important. So in terms of key takeaway from what we saw, next key takeaway for Burkina Faso here is that about 8% of people responded that they delayed or skipped their healthcare visits. So the main thing here is people delayed conducting the healthcare visit. The second thing is that about a quarter of the respondents had limited portion of, in terms of the meal and the number of meal. So there is a reduction of portion and also number of meals people have taken. We also noticed that 21% of people responding said they will not be able to find 20,000 francs CFA, which is about $50, to pay for an emergency. We also noticed that more than 60% of employed people earn less during that period of survey. Finally, 50% of primary and secondary education children spend time on education at home during that period, which shows also people were committed to how to maintain the education of their kids during that period. So I'll give now the floor to my colleague, Shana, I think Shana or Samuel, to continue. Thanks.
Bonjour à tous. Good morning, everyone. This is Shana Warren. I'm a research scientist at IPA, and I designed the RECOVR survey. So let's first jump in to the section on health and COVID mitigation. Next slide. So here are 4 key findings, beginning with Côte d'Ivoire, as you can see from the flag in the upper right. So on the upper left, we noticed that 14% of respondents say they delayed or skipped needed healthcare visits since mid-March. And most of these delays were due to the ability to afford care. And there was no major difference based on household poverty status, poor or non-poor, based on our poverty probability index calculations. In the lower left, interestingly, we see that 41% of respondents feel their household is at risk of contracting COVID-19. However, this means that nearly 60% of households do not feel at risk. Okay? For those who do not feel at risk, overwhelmingly, they feel it's because they're following preventive measures. This is quite helpful because it indicates not that people don't believe that there is a concern, but simply that people believe that by practicing preventive measures, they can protect their families. In the upper right, we see that 89% of people say that they wear face masks in public. And those that don't, it's simply because they either don't have one or they don't feel it's needed. And we should keep in mind that many people, particularly in rural areas, can safely go out without a mask because they are not encountering other people within a 2-meter distance. Finally, on the lower right, when thinking of the effects of COVID-19 on Ivoirians, respondents are most concerned about health. 51% were most worried about the health impacts of COVID, and about 32% about the economic impacts. Next slide. Turning to Burkina Faso, as you see from the flag, looking in our upper left, some of the most important results here, we find that about 8% of respondents have delayed or skipped needed healthcare visits since March. And in Burkina, we find that the concern has been around long waits or understaffed clinics. This has been a particular concern in Centre Nord, Centre Est, and Haut Bassin. In the upper right, we find that 39% of respondents say they feel their household is at risk of contracting COVID. So 61% do not feel at risk. But again, as we saw in Côte d'Ivoire, more than 80% of these report it's because they're following preventative measures. And there's a similar breakdown between poor and non-poor households. That is, people feel that they are following preventive measures, not that the disease is not a potential impact. In the lower left, we note that nearly 2/3 of the sample is washing their hands more often, but there are a number of individuals who say they had to limit hand washing below the amount that they felt they should be doing because of a lack of access to clean water or soap. Okay. So on this question, even if respondents are telling us that they wash their hands more often because they believe that this is what they should be doing, it still tells us that people know that hand washing is an important preventive measure. And this is, again, a hopeful sign. On the lower right, we find that almost 40% of Burkinabe did not stay at home on any day in the past week, while about 22% are staying home every day, and women are indeed staying home more often than men. This suggests that most Burkinabe are continuing to go about their daily business when they go out. Next slide. So in this section, I'm going to turn to economic activity and employment. First, I will cover, as before, Côte d'Ivoire, and then I will move on to Burkina. Okay. So first of all, almost 70% of respondents who worked for pay for one or more, almost 70% of respondents worked for pay for 1 or more hours back in February. And yet, of the 67% who were working in February, 20% have had the businesses or place of employment closed in the interim. Okay. This is a notable drop in employment. And almost 2/3 of respondents with businesses faced decreased demand due to COVID-19 restrictions. So businesses were suffering from decreased demand during this period. Next slide. Okay. Of those still working, post in the COVID period, so this survey was undertaken several months into the COVID crisis, 35% are working fewer hours than before, and more than 60% report decreased earnings. And this impacts poorer respondents relatively more than wealthier respondents. Okay. Women's places of work are also more likely to be closed temporarily due to the outbreak than men's places of work. Respondents working in the service sector and agriculture are more likely to be working in the past week, and their workplace is more likely to be open than those working in retail and trade. But respondents in all sectors are similarly likely to experience reduced and delayed wages and benefits due to COVID-19 restrictions. Next slide. Okay. So of businesses with more than one employee, that is small businesses, but not just individuals who are working for themselves, when we compare respondents with formal contracts to those who are working more informally, we find that respondents with informal contracts are more likely to experience a reduction in earnings or working hours, as you can see in the center pair and on the right-hand side. Particularly, their earnings have decreased. This also suggests that the economic impacts of COVID broadly in Côte d'Ivoire have fallen disproportionately on the most disadvantaged, informal sector workers, women, and poorer Ivorians. Next slide. So now we will turn to some of the core findings from Burkina Faso. We find that almost 60% of respondents worked for pay for at least 1 hour a week during February. This is a standard measure of, is someone employed? And then of those working in February, 40% are still working today. And employers and businesses experienced decreases in both supply and demand and depreciation of productive capital. This is a major impact on the employment sector in Burkina. Next slide. Okay. So of those still working, 50 to 60% are working fewer hours and their earnings have decreased. Furthermore, as we've seen before, poorer respondents are more likely than wealthier respondents to have lost working hours and pay during this crisis. And labor force participation has decreased for women. More than 60% of individuals employed in manufacturing and retail have actually spent fewer hours working and earned less pay than they did in a typical week before government closed schools. As in Côte d'Ivoire, the most vulnerable are facing the most severe impacts, women and poorer respondents. I'll now hand the presentation over to Samuel for the next couple of sections.
Thank you so much. Hi, everyone. Bonjour à tous. It's a pleasure to continue this presentation. So I'm going to walk you through the last 3 sections, one on social protection and financial resilience, another one on education, and the last section on family planning. And the same, the flag will help you identify which countries is being referred to. So first, let's start in Côte d'Ivoire with our survey. So some of our survey outcomes could help us infer household vulnerability. And we have selected for this presentation 2 dimensions, one on households' use of their savings during the pandemic and the other one on their access to food. We make 3 main observations. Those are the 3 that you have on the slides. The first one, the observation on what respondents report about the use of their savings. So what we observe is that more than 70% of respondents say they have had to deplete savings to pay for food since February 2020. And you can't see them on the slide, but poorer households are more likely than wealthier ones to say they have had to sell assets to pay for food since February 2020. A second important observation that we can make is on the use, the food consumption, if you want. And we observed that 61% of our respondents are saying to have had difficulty buying the amount of food they usually buy because household income has dropped. And the third observation that we want you to take away is the size of meals, which states that the survey has revealed that 40% of respondents have had to limit portion size at meal times or reduce the number of meals, as we said in the beginning. I believe a takeaway from this slide on social protection and financial resilience is that we seem to observe a large increase in vulnerability across multiple measures in Côte d'Ivoire. If we now move to Burkina Faso in the next slide, please. So in Burkina, we use exactly the same proxies for financial resilience and social protection, and we will also use, as Marius pointed in the beginning in the summary of the results, another one which was whether a respondent was able to find a relatively lower amount, 20,000 FCFA in this case, in case of an emergency. So what we note to start with is that 21% of respondents would say they would not be able to find 20,000 FCFA to pay for an emergency. And so that's the last box on the slide. And when you look at these, looking at rather poor versus non-poor and women versus men, you will notice that we notice that women expect to have more difficulties obtaining those emergency funds than men. And poorer respondents also expect to have more difficulties obtaining those emergencies. So basically, wealthier respondents are more likely to obtain emergency funds than poor respondents. The third observation, the same as we made for Côte d'Ivoire on the items that I indicated. So 30% of respondents say they had to deplete savings to pay for food, healthcare, or expenses since February 2020, and poorer households are more likely than wealthier ones to report having to sell their assets to pay for food, healthcare, or other expenses since February 2020. And interestingly, we also observed that 1 respondent out of 4 is saying basically that they had to limit portion size at meal times, or even reduce the number of meals in the past week. So that's the third box in the slide. And poorer respondents, again, are more likely to report that than wealthier ones. And the last observation that we would make here is that 50% of our respondents are describing difficulties in buying the amount of food that they usually buy because the price of the food was too high. And an interesting observation that we made here was that respondents with school-age children were more likely than those without to say that they had had difficulties buying the amount of food. So let me now move to education, where we had also very interesting results, 2 on Côte d'Ivoire and 2 on Burkina. The first one, on education, we also collect a couple of indicators, and I will just give you the main takeaway from this presentation. and this was also one of the things that surprised us, is that children rely mostly on traditional learning tools. These will mostly be books, much more than ICT tools. We know, even from conversations in country with various stakeholders, this was something relatively interesting. At least what we are finding seems to be suggesting a need to have more combined approaches in policy responses to the crisis. So if we dig a little bit in funding, the two figures that you have on the slide, so you will see that approximately 70% of respondents report that primary and secondary school children are spending time on education at home, which is great. And wealthier households are more likely to report that than poorer ones. A second observation, as I already talked about in the takeaway, is that among children engaged in distance learning, the majority are using books, and we have the same for both primary and secondary schools. So households, when we look at the difference, Abidjan versus the rest of the country, households living in the capital were more likely to report that children in primary schools were using books, while households living in the capital were more likely to report that children were using TV and internet to help continue their education. So a second, again in Côte d'Ivoire, a second set of results on the use of household time during the lockdown, on the next slide, please, is that, yes, thank you. So we note that other than education, almost 60% of primary school children are spending time on education, on household costs, sorry, or domestic work at home during the lockdown period. So this is 70% for secondary school children. And households will also, report at least six households out of 10 will report that school-age children have already returned to school. You know, one of the things during this survey was that schools were reopened and we could assess whether parents had sent their children to school, and we noticed that 6 families out of 10 had sent their children to school. And surprisingly and interestingly as well, poorer households were perhaps more likely to report that school-age children have already returned to school since schools have reopened. And the 40% difference on this sample, you know, as we said in the beginning, this is a nationally representative sample, could probably raise concerns about delayed school openings or eventually school dropouts. So some of these new questions are already candidates for our second round of RECOVR survey. So if we move to Burkina, what we notice is that I'm thanking you for continuing to follow. So we are now in Burkina, and we would notice that respondents would report that 50% of primary and secondary school children are spending time on education. So they are spending time on education, they are working at home, and wealthier households are more likely to report that. And more than 40% of households report that primary and secondary school children are using their own school books to spend time on education at home. So I think a takeaway from this slide could probably be the fact that we do not see a clear dominant strategy by households to continue children's education during lockdown, at least based on this survey. And let me conclude with this last slide on education to note that on the last slide, please, if you can click next, please. Thank you so much. So other than education, primary and secondary school age children are predominantly spending time on household chores. So it's approximately the same that we also saw in Côte d'Ivoire. And 65% of households with primary and secondary school age children say their children plan to definitely return to school once reopened. So the question is different here. In Burkina, the question was whether people were going back to school, whereas in Côte d'Ivoire, school had reopened and wanted to know whether parents had sent their children to school. So we have no difference, poor versus non-poor breakdown. So at the time of the survey, almost 30% of households were not yet certain, this is quite interesting, that children will return to school, and 10% did not plan to have their children return. So again, these questions will hopefully get some answers, some deeper answers during our next round of RECOVR. So I will close for the last 1-2 minutes on family planning So on the family planning, and this is the last slide, we saw in Burkina Faso that almost one household out of 4 is reporting that accessing family planning has been much more difficult during the lockdown. And in the meantime, a little more than one household out of 4 has used a contraceptive method, with a large majority intending to use it in the future. And the last observation before giving back the floor to Arthur is that almost 3 respondents out of 4 have heard messages about family planning on the radio. Thank you so much for your time, and we look forward to your questions. So Arthur, over to you. Thank you.
Thank you, Samuel. And thanks a lot for presenting these results. I would now like to speak with our panelists, Ben Anderson-Coffey and Tessa Swigart, to whom I will ask direct questions in terms of what is their interpretation of the results and how those can be used. Anderson, I want to start with you, so you can unmute yourself. And I'd like to know, as the technical advisor to the General Director of Employment in Côte d'Ivoire, what do you think of those results? What is your interpretation of it? And are there plans in place within the General Direction of Employment to use those results, and how? So we cannot hear you, Anderson. Can you try to unmute yourself?
I've got trouble with my, yes. Now, can you help me, please?
Yes, we can hear you now.
Okay, now you hear me, okay? Well, okay, I'd like to thank everybody for this webinar, giving us the opportunity to talk about this health crisis. And like you said, I am Ben Anderson-Coffey. I am technical advisor to the DG for Employment in Côte d'Ivoire. And on behalf of Mr. Dogo-Frank Madou, the Director of Employment in Côte d'Ivoire, I'd like to thank you for the opportunity you are giving us to comment on the results of the RECOVR initiative in Côte d'Ivoire by Innovative Poverty Actions. My intervention will focus 3 areas. But before, you have to know that in Côte d'Ivoire, the first cases of the COVID-19 pandemic appeared in mid-March 2020. And the lockdown, curfew, and quarantine measures that were imposed by the government impacted our life. As instructed by the government, the Directorate General for Employment produced an information note on the impact of the COVID-19 on jobs by exploiting the existing databases, not on the impact that we obtained, in 2017. We got the results from the 2017 study through what we call here the RECOVR. That is, it's a yearly study which focused on employment and the informal sector. Well, sad to say, this data did not prove enough relevant in the new environment of health crisis. We came to conclusions that were certainly relevant, but we needed to have fresh and updated information, hence the interest that the government of Côte d'Ivoire is giving to the study conducted by IPA. To come back to the result of IPA in Côte d'Ivoire and specifically how we are going to use them for the resilience phase, like I said, I will focus 3 sectors. The first sector being the health sector and the mitigation of the COVID-19, the social protection aspect and the financial resilience, the economic activity and employment. So my presentation will be revolving around these 3 aspects. Well, talking about the health and the mitigation of the COVID-19, the survey that was conducted by IPA reveals that 41% of respondents are afraid of the COVID-19, meaning that more than 50% of households are not afraid of the virus. So if this evidence is due to the compliance of households with the barrier measures imposed by governments, this reassures us. Otherwise, this result should draw our attention in the light of the damages to some key sectors of our life. Besides, this virus could promote the aggravation or even emergence of other diseases, as the results show that medical appointments had to be canceled or postponed because of the situation. That's about 14%. Now, in the light of what I've just presented, what are the actions that the government of Côte d'Ivoire is going to, let's say, to undertake? We will be planning to increase awareness through all sensitization channels. The majority of surveys show that television remains the main channel used to convey messages. However, it will be compulsory to explore other channels. We also need to ensure that people always have access to the protection kit, given that the barrier measures are currently being eased. And finally, as third action that we are going to undertake is to ensure that compliance with barrier measures are also made through the coercive method, that the police control people. If people are wearing masks in the street, when people are gathering, are there, respecting the 1 meter distance, things of this genre. So thanks to the police, we're going to make sure that all these measures are respected. Now, the second aspect that I think is very important for me to point out is the social protection aspect, and what we call the financial resilience. At this level, the study reveals a financial vulnerability up to 70% and food insecurity too. 61% of Ivorians have some difficulties to buy the quantity of food necessary for normal diet due to the drop in household income. And the 40% have limited the portions of meals or the number of meals during the past week. Take into account when the study was completed. These two such situations described above can be explained by the very nature of employment in Africa in general, but in Côte d'Ivoire in particular, as employment is mostly informal. You know that 9 out of 10 jobs in Côte d'Ivoire are in the informal sector. In the face of such a crisis, people employed in the informal sector immediately become at risk. It's quite obvious. One of the characteristics of the informal sector in Côte d'Ivoire is that incomes are not fixed and are mostly below the minimum wage most of the time. Therefore, recourse to transfers from friendly households becomes an alternative for the majority of them, because the savings rate is very low, at around 3%, according to the study that we conducted in 2015. And we call it ANV. It's a kind of a study of people, how they live in the light of their income. So what we keep in keep in mind here is that the saving rate in Côte d'Ivoire is very low. And what kind of actions can we start doing here? First, if we think it important to refine our actions to respond to COVID-19 by pursuing by pursuing actions for the transition from the informal to the formal economy. And at this stage, I'm very pleased to recall that Côte d'Ivoire, with the support of the ILO, has developed a strategy document on the transition from the informal economy to the formal economy. And this study was released on February the 12th, sorry. We will also promote jobs with resilient incomes, improve the management of funds to support vulnerable households. This is a challenge because we'll be receiving some amounts, some funds for dealing with, this health crisis. What is important here to know is that we have to make an effort to improve the management of these funds. And finally, we have to ensure that the results that IPA has produced are taken into account in the situational analysis when developing future cycles of strategic documents. The third aspect that I would like to talk about is the economic activity and employment, which is the core element here. In Côte d'Ivoire, the agricultural sector is predominant. That is about 50% of our economy, can be found in this sector, in the sector of agriculture. And the strong impact on agriculture, estimated at 76%, therefore, concerns a significant fringe of the population. Also, we know that informal employment is still high. Like I said, 9 jobs out of 10 in Côte d'Ivoire are in the informal sector. So the individuals there are living from day-to-day income. The strong decrease in wages and income, especially for the poorest, up to 65% becomes obvious. In sum, the characteristic of our economy could not hold up long enough to the barrier measures imposed as a result of COVID-19. These results converge with those of the National Statistics Institute, which are even project and estimated 131,678 job losses in the formal sector by December 2020. What kind of actions do we have to take? At this level, the data from the study will serve as decision support. The government will be needing further studies to refine certain aspects of this study, but the Directorate General for Employment will introduce a module on COVID-19 in its employment survey, and at this level, we will be needing the help of the ILO too. The Directorate General for Employment also plan to produce a summary note of all the studies on COVID-19 with a view to translating them into action. And we also continue to initiate voluntary policies to save jobs, to support enterprises, including those in the informal sector. Once again, I would like to thank IPA for the good job that they have conducted through this study. And I'd like to stop here. If you have some questions, maybe I will be answering the questions. Thank you very much, Arthur.
Thanks a lot, Anderson. Before I move to Tessa, I would like to mention that there will be a second round of surveys in August in both countries, which will allow us to follow up with the same respondents 2 months after the first survey. So this will also provide some data, some more longitudinal data.
Yeah.
Thanks a lot, Anderson. Tessa, could you let us know what your interpretation of the results is, and then maybe explain briefly what Development Media International's response to the COVID-19 is in Burkina Faso, and how the results presented today could be used to inform that response?
Yes, sure. I just wanted to say thank you also to IPA for involving us in this survey. It's really useful to our organization, and we've had great partnerships with IPA in the past. So my name is Tessa Swigert. I'm a research manager at Development Media International, or DMI. DMI works to on public health campaigns using mass media. And we've done a few randomized controlled trials in Burkina Faso, one on child survival, and then we partnered with IPA for one on family planning. And we primarily are using radio in Burkina Faso, but we also have some television broadcasts. And currently we've got 3 different campaigns going on in Burkina Faso, which these results are gonna influence and give evidence on where we should prioritize some of our messaging. And we've got a scaled up campaign on child survival, where we're messaging on, well, the objective is to reduce mortality due to kind of the biggest killers of children under 5, malaria, diarrhea, and pneumonia, and we're adding some messaging on maternal and neonatal health as well. And we have a scaled up family planning campaign as well. And then we've also done a messaging response to COVID, working with the Ministry of Health to see what their priorities are with getting information on COVID out there. So we've done some messaging on prevention and, information about COVID and social distancing, vulnerable groups, sort of trying to inform the public about it. So my interpretation, there's some of these results that were in the survey that are kind of more interest to DMI just in terms of our current campaigns. And that's more the health and family planning indicators. And, but my interpretation, I think probably the biggest sort of impact that I'm seeing is the economic impact, which is not a big surprise at all because, the whole world's economic, it's been really impacted economically. I think another big takeaway is that we've actually done some formative research, and this is, and it backs up. They're very consistent. The formative research results that we've gotten are consistent with the IPA survey, but that's just the really high compliance with preventive measures that we're seeing. And there may be some social desirability bias, but just the fact that people are, very aware of preventive measures and reportedly compliant is, well, it's a positive thing. And so kind of in terms of how we're going to be using this information, so there was less effect on treatment seeking and routine kind of health services than we thought. And I think that the next survey that IPA does in August is going to be very of interest to us to see if that's shifting in any way. The security is also, the security situation in Burkina is also kind of deteriorating, and so that's affecting health centers as well. But the fact that there's been long waits and due to understaffing the fact that there's slightly over 8% that have sort of reduced their healthcare visits. We need to keep our eye on that. But also I think so our messaging has traditionally focused on demand generating. So making sure that parents or caregivers know that they need to seek treatment for malaria, diarrhea, and pneumonia. And I think that we continue to message on that, but we also really need to focus on prevention measures as well. And so we'll probably be shifting our priorities for the messaging on that. I think the family planning, almost 25% were saying that it's more difficult to access family planning. The fact that, there is such an economic impact. It's understandably shifting people's priorities to day-to-day needs, and that might understandably deprioritize people's family planning. And so I think that actually highlights how important messaging on family planning is right now. And so we want to make sure that we kind of shift our focus on, shift our focus to messaging on stocking up on family planning, on contraception if they need to, or kind of highlight long-acting methods. And the last kind of big sort of takeaway for us with these results is that we really haven't, so far, we haven't highlighted probably now as much as I think is important, that the fact that treatment for malaria, diarrhea, and pneumonia in Burkina Faso are free. And then Burkina Faso recently has rolled out free contraception. So because there has been such an economic impact, we're going to start really highlighting sort of accessing free services and treatments that are needed. And I think 60% have an intention to use contraception in the future. So, so we need to be addressing that 60% and the importance of kind of planning ahead, especially if there is the possibility of stockouts in the future. But I think, the surveys just gives extra evidence for our campaigns, which is really helpful. And it's also going to be a really good benchmark for the next round of surveys to see how things are shifting and in which direction they're shifting in. But yeah, so we really appreciate the survey and the impacts that it has on our campaign messaging. Thank you.
Thanks a lot, Tessa. This is really useful to understand exactly, how an organization like you can use the results, and I'm glad that we can continue surveying the participants to help you improve your programming. We are only a few minutes away from the end. I see that most questions have been answered already textually. But I will ask Shayna to respond to one question for me, and maybe give a very few words about the second round of survey we're doing in August. So Shayna, do we know the reasons why, or the reasons behind the 40% of children who didn't return to school since schools have reopened?
Yes, thank you for the wonderful question, Sabine. So I can speak to Côte d'Ivoire at the moment. I was just looking into the answer to this question. So what we're finding is predominantly, so we do ask why parents are not definitely planning to return their children to school. So this question was asked even of parents who said probably, but not definitely, and all the way down to people who said absolutely not. What we're finding is that over 40%, 43% are just broadly concerned about the health impacts of COVID. And then we find another group, so 46%, and people could cite multiple reasons, since we know many people have multiple reasons for their educational decision-making. 46% cite that they are worried about preparation. So of that, most of them are concerned specifically that the schools aren't prepared, and 14% said in particular that they didn't think teachers would be prepared for a return to school. So these findings suggest that if, in order to get more Ivorians to send their children back to school, you need to reassure Ivorians that their children's health will be safe and that schools are ready to welcome students back. I think these are similar concerns to what we've seen in many other countries globally. Thank you. Then to follow up in terms of the second round, so we're in the planning phase of the second round. one of the things that I will be looking at as I plan the second round of the survey is looking at some of the questions that have been asked today, the areas of particular interest, as well as feedback from our partners in Burkina Faso and in Côte d'Ivoire, depending on the survey, to see what people would like to learn more about. We'll also consider how the context has changed since mitigation efforts were first put in place back in March. As schools open, we ask different questions. Otherwise, I welcome any feedback and we'll try to respond to any additional questions later. I do see I had a question about margins of error for the survey. This very much depends on the specific question. When you do phone surveys like this, we only learn the demographics of those who respond to the survey, not the demographics of those who don't answer the phone. We know only their phone number. So it is difficult to make an assessment of how this represents the population as a whole. We do know that our sample is more urban and more educated and wealthier because this links to who has a phone and lives in an area with cell phone coverage at the time of the survey and who might be available to respond. But if you have further questions, I'm happy to answer. Thank you.
Thanks a lot, Shayna. I see more questions are coming. We will not have time to answer those right now, but if you are interested in having more discussions about these results, feel free to reach out at contact@povertyaction.org or or by looking on our website directly, the country contacts that you will find there. We know all of you here today have very different backgrounds and roles. So if you're interested in partnering with us, the same, feel free to get in touch directly with us and to open the discussion. I want to thank everyone for joining the webinar today. Particularly, I want to thank Anderson and Tessa for taking the time to discuss the results and explain how this can be used for their programming. And then maybe for some of you, it will have helped you also understand how it could be useful for your organizations. Feel free to send us further questions that you might have. And as mentioned before, the webinar has been recorded and will be available after the section. Thank you, everyone. Have a good end of the day. Bye.